Despite a federal judge blocking the Trump administration's federal funding freeze, critical programs say they still can't access their funds, including one that the White House says should never have been impacted in the first place. The National Head Start Association reports that more than 45 Head Start programs in 23 states, which provide child care and preschool education to 20,000 low-income children, have been unable to access previously approved federal funding for the last week now. Without that access, those programs are at risk of having to close their doors in a matter of days. Joining us now, National Head Start Association Deputy Director Tommy Sheridan. Thanks for being here with us. Who are the kids that are going to be impacted?
Yeah, Katie, thanks for having me and covering this. The children that we're talking about are really the children and families that face some of the most significant barriers to achieving success in school and in life. You know, they really rely on the stability and support that Head Start provides to them. And these are kids and families who are experiencing homelessness, who are part of the foster care system, who are eligible due to income and disability to be served. And so really the kids and families that again, really need that stability and support that Head Start provides.
Where are these kids?
Everywhere across the country. I think you cited a 46 number. That number has actually changed. This is an ongoing story. It's changing literally by the hour. The latest numbers that we just polled is that we're hearing from 37 Head Start grant recipients, so trending in the right direction, that are still having trouble accessing the funds, and that is in 20 states, plus the District of Columbia and Puerto Rico.
Is this just blue states where it's happening?
No, this is not. No, it's at this point it is all states across the country. We've seen this number go up to about 27 states, back down a little bit. And it's not the thing about Head Start is a federal to local funded program. So the resources that the federal government provides actually go directly into individual communities. That's what helps us address really the specific needs of individual communities and the specific needs of children and families. So when we're talking about the impact of this, we're talking about this coming very substantially on the kids and families that need these services the most.
I wonder, have you gotten an answer from the administration about where this money is and why it's still frozen?
Yeah, so it's I actually wouldn't characterize it that it's frozen. It's complicated, and that's confusing, and that's the unfortunate thing. At this point, you know, we have heard that this issue is again not directly connected to the freeze, but it is also indirectly connected to the freeze last week. We're not hearing directly from the administration on this, but have heard via Congress, who's been in touch with the administration, that this issue is a result of too many grant recipients, Head Start and other HHS programs, Health and Human Services programs, that last Tuesday sought to draw down funds from the system called the Payment Management Services, the PMS. And everybody really attempted to draw funds down right away from this service early Tuesday morning of last week. As a result, that the system wasn't prepared for that. It shut down. So many individual programs had requested, and I don't mean just Head Start again, this is all of HHS, had requested basically more funds than they should have been requesting, as they were likely afraid of this the funding freeze that had been noted in the OMB memo. And so as a result of that, it locked people out. It required manual reviews of thousands of these funding requests. This is a system that normally operates pretty quickly, but it was really got quite messy very quickly, and now we're still playing catch up.
So you're saying there was essentially a run on the banks. How quickly do you need this money in order to make sure people get paid? I mean, there are folks that are coming in and working these jobs who need a paycheck themselves. So what is your time frame? What is the necessary amount of time you need to make sure that this gets resolved?
Yesterday. No, I think it's, this system normally takes a couple of hours, and it's going to be different in every single community. Part of the beauty and part of the challenge of Head Start being that federal to local is that every community has different needs, different opportunities. They have different funds that they have access to. And so in this specific situation that we're talking about, programs that are trying to draw down on these resources, some of them only have operating expenses for a matter of days. We did see some programs have to close down as a result of this over the last week. And luckily, most of those programs have gotten back up for services. But we are aware of the 37 that I just noted, that there are a couple who, if they don't receive funds today, they are going to be looking at having to close down services as of Monday. It's not just payroll either that we're talking about. It's also to local businesses, to vendors, to other folks that do provide services to Head Start programs as well that we need to pay.